Welcome to Cut Through the Noise with Dave Toronto, bringing you the truth behind the headlines in business and current events. Let's go!
I have some ideas on how we can manage through COVID going forward. And I, like probably most of you, am so sick and tired of this topic, but because it won't go away, I've got to talk about it too. So I want to just kind of frame this by saying I'm not just going to rant and rave and bitch and moan about it. I'm gonna provide some thoughts and ideas that may allow us to be a little bit more proactive when it comes to this damn thing. So what do we know as to today? It's the end of October. We know that cases are on the rise again. We know that, people are still dying from it. And we know that the ratio of people dying is dropping. As the cases are rising, the ratio of people passing away is actually going down. It's somewhere around 2.68% right now. So if you have it, you have about a 2.68% chance of dying from it. And what do we also know? We know that age and pre-existing conditions play a major role in our likelihood of succumbing to COVID. So when I say pre-existing conditions, I mean heart disease, diabetes, COPD, certain cancers, kidney problems. Those are the types of things that would constitute a pre-existing condition. And there's others as well. And so we're sitting here and we've in some areas just shut down. In other areas we open, we shut, we partially open, we partially close, we temporarily close, schools, ice rinks, you name it. It's just insanity the way we're managing this. And I'm going to say this also, my 2 cents on our decision makers across the board, from the president all the way down to the local leadership. Disaster. Absolutely everybody. Democrat, Republican, idiot. I can't stand anybody. I've said this before. I'll say it again. None of these knuckleheads know how to do anything other than blame somebody else for their own mistakes and their inability to communicate and work together and make sound decisions. And I think a lot of it is they don't know what's going on. And quite frankly, I don't know that anybody really does. I don't know that anybody, from the media to the politicians to the, whatever, really are taking the time to proactively think through what do we need to do to deal with this damn thing going forward. Because here's the deal, everybody. COVID is not going to go away, just like the flu's never gone away, and pneumonia's never gone away, and bronchitis hasn't gone away, and the common cold hasn't gone away. It's here to stay. So we better learn to live with it. And I'm tired of hearing, well, we're dying from it. You know what? We are dying from it. But I want to break that out a little bit and come up with some reasons as to why I think that is, and then some ways, simple things that we can do to potentially increase our chances of not dying from it. Because you know what? When that vaccine comes out, or these vaccines come out over the next, month or 6 months, they aren't the answer. Just like the flu vaccine isn't the answer. We've had a flu vaccine for years, and it changes as the flu strains change. But the average flu vaccine is about 40 to 60% effective at reducing flu-like symptoms. I can't imagine that the COVID vaccine is going to eliminate COVID. I don't buy it. I'd rather go into it thinking, you know what, like it or not, this damn thing's here to stay. What can we do to improve our odds? So when I think about the pre-existing conditions, heart disease, I listed these a minute ago, heart disease, diabetes, COPD, certain cancers, kidney, what do most of them have in common? What's one thing that drives these problems? And I left out things like stroke, like a history of stroke and things like that. The one thing that's common to almost all of these, with the exception of kidney, and even that I guess you could attribute it to it, is obesity. And the reality is we are an unhealthy country, and we aren't alone. The United States is getting a ton of criticism for the way we've handled this whole thing. And yes, it's been a problem. But when I compare the United States to Europe, it's bad in both places. So this is not a U.S. problem. This is not a European problem. But the U.S. and Europe by far exceed the world rates when it comes to this. Why? Is it lack of leadership? Maybe. I would say there's a lack of leadership across the globe, but that's not it. You know what it is? It's us as people. We don't take care of ourselves. Let me explain to you what I mean. These pre-existing conditions are often as a result of being overweight. You probably already know this. If you don't know, go do your research. I'm not going to tell you where to get the numbers. I can tell you that you can find them on the CDC site. You can find them on the World Health site. You can read about this stuff. And some people are very leery about what's real and what's not. But when I cross-reference these different entities, I find that the data looks the same. So at some level, I'm not going to throw it all out as horseshit. Some of it's got to be real. But and go Google whatever you want, figure it out on your own. But here's what I found out, and this was shocking to me. And I've seen these stats before, but I never really paid attention to them. So adults in the U.S., which is 20 and older, people that are 20 and older in the United States, 70% of us are overweight. Overweight means that your body mass index exceeds 25% or is between 25 and 29.9%, which means that your body fat as a percentage of your height and weight is that much, 25 to 29.9%, which is considered overweight. Anything 30% or over, you are considered obese. And 42% of the U.S. adult population is considered obese. Those same basic numbers also apply to the European population. This is what kills me about this. We are bitching and moaning about the bad decisions that our politicians are making. And I agree. They're all idiots. I'm not going to sit there and defend any of them. We're begging and waiting on a vaccine so we can open schools and to, open up the world again and be safe and all this. But you know what? That's not going to work. The vaccine's not going to work for everybody. It's not going to make this thing go away. Social distancing is not going to make it go away. Masks are not going to make it go away. That's not to say that we shouldn't social distance or wear masks. I do it. I think everyone should do it. It ain't going to make it go away, though. What it's doing is it's making it a little bit harder to spread it. But I don't believe it's going away. That same solution could apply to the flu or a cough, etc. What's got to happen? What's got to happen is we all have to look in the mirror at what we choose to eat and drink and take and think every day. That's what we need to do. Another stat that I thought was just wild. I'll just generalize here. 75 to 90% of the U.S. population overconsumes sugar, salt, and saturated fat. 75 to 90% of the U.S. population underconsumes fruits and vegetables. And 77% of the U.S. population doesn't exercise enough. All contributors to being overweight and being obese. Obesity is a major contributor to all of the pre-existing conditions that our COVID patients are suffering from that make it more likely that they die. Vaccines aren't going to make any of that go away. Our population in this country and in Europe has the obesity within the adult population has been exploding for 30 years, 35 years. We have more processed foods on the shelves than ever before. We drink alcohol and take prescription drugs like they're going out of style. Smoking has gone down, but other things have gone up. It's just crazy how poorly we take care of ourselves. And why is that a big deal? I don't care. Look, I snack. I eat some things that I shouldn't. I drink. I might have too many drinks every once in a while. But at the end of the day, when eating improperly, drinking too much, or taking too many pills, or smoking too much, whatever you smoke, becomes normal, that means you're developing habits that are going to be nearly impossible to break. And that's the issue we have in this country, is poor, undisciplined habits. And then over time, those undisciplined habits are tearing our bodies down and destroying our immune systems. So when we're going to get COVID, I'm just waiting. I sit here every day. I'm like, it's been 7 months. I don't want it, but I'll be relieved when I have it and I move through it, at least for this year, because it'll come back again. But I've seen so many people I know in my neighborhood, in my town, family members who have contracted it and moved through it. Most of them symptomless, maybe some sniffles, an occasional ache or a headache, and they've moved through it. The people that I know who have passed from it, for the most part, are in their late 80s and early 90s with many pre-existing conditions associated with heart disease or cancer or something that I named earlier, which sucks. It sucks. But the thing is, when you're 90 years old, you're already 12 years beyond the average age of a human life. Okay, so you're on borrowed time. It's all gravy. If I get to 90, fantastic. I don't expect to get there, but if I do, wonderful. That'd be great. But I hope I'm there healthy. I hope I'm there healthy. I don't want to be an unhealthy 90. I don't want to be an unhealthy 50. All right? And I'm not going to do anything to contribute to my lack of health. I have pre-existing conditions. I am a healthy person. I'm an active person. I eat well, but I have pre-existing conditions that I can't seem to get rid of. I have had asthma and lung issues since I was a little kid. I've been hospitalized for asthma. I've had multiple inhalers over the course of time, different strengths. I've had multiple bouts with bronchitis and pneumonia over the years. It's just the way I'm wired. I can't do anything about it. And I'm not a smoker. I've never smoked. I've never smoked a cigarette. And I don't smoke weed. I don't do it. But yet I've had lung issues since I was a little kid. And I still run into those issues now. They're not debilitating. I also have high cholesterol. I don't eat saturated fats. I've cut out dairy for the last year. I don't eat processed food. I don't eat wheat. I don't, all those things. And yet I have high cholesterol that I've been able to work into a manageable situation without medicine by just changing my diet. I also have sleep apnea. I'm not overweight. I have all of these pre-existing conditions that an overweight person would probably, or it wouldn't be unusual for somebody who is overweight or obese to have. High cholesterol, trouble breathing, and sleep apnea. I don't fit the description of anybody that would have those three things, but I have all three of them. What I do to try to counteract it is I eat as well as I can. It doesn't mean I never deviate. I don't drink to excess, and I exercise every single day. I don't want to end up in a flippin' hospital, COVID or no COVID. I've been in and out of hospitals for the last couple months with my wife. She had a procedure. She had some complications from the procedure. Everything is fine now. But 2 weeks ago, I called 911 for the first time in my life. It scared the crap out of me. And we ended up in ended up in the ER in one of the Boston hospitals. And then we were back in another ER the following week. It was scary and everything's fine. The reason I say I don't want to end up in one of those places is this. We got in, and those emergency rooms are a disaster. And by the way, they weren't loaded with COVID patients. We weren't at the mercy of these doctors and nurses running to deal with COVID patients that didn't have ventilators. That wasn't the issue. There were people, older people, younger people with different circumstances there for whatever, a heart attack, or God forbid, there was some strokes in there, and there were some gunshots in there. The thing that killed me is these doctors and nurses are so overworked during normal times. We weren't dealing with COVID crisis, and it's October when numbers are starting to spike. I can't get over how little these doctors and nurses are able to retain, and I mean little. we were retelling the same story to every single person that came into the room as if they heard it for the first time. They didn't have the notes from the previous doctor or the previous nurse. Getting a cup of water, it took an hour and a half at one point. Getting an extra blanket would take an hour. The level of attention that they pay to an average patient is limited. And the thing that pissed me off most was how many police officers I saw come in and out of this ER in Boston, one of the best hospitals in the world, allegedly. And we're just dealing with person off the street after person off the street trying to escape, coming in cuffs. They'd uncuff the person to try to move them to a different bed. They'd take off. The cops would have to tackle them. And these people wanted nothing to do with help. All they wanted to do was fight and argue and this and that. And I'd overhear the conversations. This guy was here last night. This guy's been here every night this week. I'm sick of it. We've got really good people that need help. My wife did nothing to deserve to be in there, and neither did a lot of these other people. And you know what happens? They have to wait in line for these people. These people come in, cause a big stir. They don't even want help, but they get to cut the line, and they get the attention of the doctors and the nurses, and round we go. And I can't stand it. My point is, and I know I'm on a rant right now, but my point is, if we don't take care of ourselves when times are good, you know where we're going to end up when we're old? We're going to end up in one of these flippin' hospitals or nursing homes where the average nurse and the average doctor doesn't have the level of attention or patience to deal with the average patient. They don't want to deal with us. And when we've spent a lifetime tearing down our bodies and our minds, there's not much these doctors and nurses can do for us when we're older. So you know what they do? They just medicate us. They pacify us. They talk to us like we're 3 years old again or 2 years old again. They change our diapers. They check on us every few hours, and they move on to the next patient. It's a lonely place to be, folks. And that's where we're going to end up if we don't start making good decisions now. COVID or no COVID. We've got an obesity problem, and we've got all these pre-existing conditions that are killing our people. And by the way, I'm not here to say that every single person who died was obese and did this to themselves. There are people who passed away just like me, just like you, who didn't do anything to deserve it. No pre-existing conditions, just an anomaly. Passed away because of an unfortunate circumstance, because they drew the wrong straw. But there are a good percentage of people out there right now who have an opportunity to make better choices each day, to eat the right foods, to drink a little less, to not take the pills, to get a good night's sleep, all the stuff that I've talked about with you guys for a long time in different episodes. It has to start happening. No vaccine is going to make this go away. I promise. I don't even think it's going to go away at all. So why don't we do something to improve our immune systems rather than destroy our immune systems? All this stuff that I've been talking about is ripping our immune systems down. And when COVID does reach you, if it hasn't yet, you're going to have less of a likelihood of moving through it seamlessly. If you take care of yourself and your immune system, you're likely going to be symptomless, or you'll have minimal symptoms and you'll be able to work through it. That's what I think we need to do. No politician and no vaccine is going to cure this problem. This is not a United States problem. This is a global problem, and it's impacting parts of this world that aren't healthy to begin with, that are obese to begin with, that have compromised systems to begin with. And we have a chance to put a stop to that by making better choices starting now. Thank you for your time.
You've been listening to Cut Through the Noise with Dave Turano. Please subscribe, and for more information, check us out on Instagram at CTTN Podcast.